I'm here with a patient who has suffered with back pain from multiple things, but he had bilateral piriformis muscle tears, and they were creating tremendous pain in his buttock, and he's had that pain for years.
Yeah.
We made the diagnosis of piriformis syndrome in both sides, and he underwent the Deuk piriformis release. It's a procedure done minimally invasive with a 4mm incision on the buttock. You had one done on the one side 3 months ago. You had another one done 3 weeks ago. Do you still have the pain in your buttocks?
No.
Gone.
Oh, that's gone.
Wonderful. How was the procedure for you? Was it pretty easy to get through?
Yes, yeah, it was. It was comfortable. I mean, I felt good after both of them. I mean, it was a good relief.
And you weren't laid up in the hospital afterwards. It was outpatient.
Yep.
It took you about an hour to recover?
Yeah.
And then you went home. When did you notice the pain in your buttocks and lower back was gone?
Almost pretty much right after the surgery. I mean, I could still feel a little bit of numbness, but yeah, I mean, sitting wise, I mean, I can't feel it when I sit.
So the pain in the butt cheeks is gone?
Yes.
Gone. Wonderful. We've developed and pioneered a minimally invasive technique for piriformis muscle release. It's for patients who have a diagnosis of piriformis syndrome, which is pain in the lower back or upper buttock region due to inflammation from a tear within the piriformis muscle. And typically we'll start with some shots to confirm the diagnosis, but also to treat the inflammation. You had the shots, they wore off, the pain kept coming back.
Yes.
Now, has the pain come back for you?
No, not piriformis, no.
Gone.
Yes.
Congratulations. Is there anything you want to tell the audience out
I
there?
want to thank him very much. I wouldn't have believed it until I'd done it. It was a relief. I've had this going on for years, man. I'm happy.
And you actually had a fusion on your lower back years ago, and that put extra strain on the piriformis muscle,
Yes.
which caused them to rip, and that's why you had so much pain in your lower back. We made that diagnosis at Deuk Spine, and we fixed the problem for you.
Yes.
Congratulations.
Thank you.
You're welcome. All right.